Hey, welcome to This Week in Pharmacy. My name's Todd Urey. I am your host, and I cannot wait to get into today's featured conversation. I'm so excited to be welcoming back Brian Urban with Best by Health. We're going to be right back with this episode of This Week in Pharmacy. Hold on a second. Hey there, welcome to This Week in Pharmacy. So, hey, we are expanding. I mean, there's so much going on. We're so excited about Jenna Quinn and the team over at TWIRx, Perfecting Peds, and the Pediatric Pharmacist Review podcast, and how Health Partners, a payer, insurance organization out in Minnesota, is now partnered with Perfecting Peds to drill down into how medications are impacting our infants and in the NICU and in emergency and in compounding and in specialty disease states. I am so proud of pharmacists and what's happening with the authority and the wingman to the physician guiding our treatment programs, and the partnerships that technology companies are forming with pharmacists is so impressive. Artificial intelligence coming out of the woodwork, and pharmacists are leading many of those build-outs and algorithms. A lot's going on. A special friend of mine who I'm welcoming back, who I'm pleased to have back on This Week in Pharmacy. We're twerksing again over here in the great city of the Steel City of Pittsburgh, Pennsylvania.
Amen, Todd. Thank you so much for having me on your show again. And man, you got a good one. We got some serious brand power here, some serious wisdom. You'll hear, I think, on this episode from Dr. Alex Ding, Dr. Marc Watkins, Humana, Kroger, and to be on your show and your platform to talk about some of the things we're going to talk about is just an honor, as always. And it's good to share Steel City with you as well, my brother.
That's our twerksing on April 11th, 2025, and we're so excited about our guests. And without further ado, I want to welcome two powerhouses in healthcare that are really changing things, and they share a similar passion that you and I share, and that is getting community level, getting into the community that we serve. And I want to welcome Dr. Marc and Dr. Ding to This Week in Pharmacy. We're twerksing. I'm not going to make you guys twerks, but if you know how to twerks, you'll get bonus. I send you one of these T-shirts.
Ooh, that's a big selling point.
Alex, introduce yourself to the listeners today.
Yeah, well, good afternoon, and thank you to your listeners for joining us today. Todd, Marc, Brian, it's great to be here with you, and really thank you for bringing together what really might seem like an unlikely group for a conversation that I actually suspect will end up connecting a lot of dots around healthcare innovation, access, and impact. So by way of introduction, I'm Dr. Alex Ding. I'm a practicing board-certified diagnostic and interventional radiologist, and I have the privilege of serving as Humana's Deputy Chief Medical Officer. So in my role, I support our national clinician workforce and lead our strategy to strengthen physician and clinician engagement, and especially how we build meaningful relationships with provider organizations, physician community. My work really sits at the intersection of clinician enablement and empowerment, value-based care, whole person care, and how we can leverage innovative partnerships to improve access, health outcomes, particularly for older adults. Great to be here with you today.
Alex, thank you so much for being here. I also want to welcome Dr. Marc. It's so good to have you here. I got to spend some time with you in the green room before we got started, but Dr. Watkins, welcome to TWIRx.
Yeah, Todd, thank you for having me. And again, I'm so pleased and honored to be here with both Brian and Alex for this enlightening conversation. So I have the privilege, and I said it to a group yesterday in a meeting, that I have the greatest job in the world. As Chief Medical Officer at Kroger Health and the Kroger Co., I wear two hats, helping with clinical strategy for our health services division of our company. So as you know, we operate a little more than 2,200 retail pharmacies across the country, retail clinics inside of our grocery store. So that's a little bit more than 2,500 access points around the country. And I'll expand on that a little bit as we get into more of the discussion. I also support our PBM. We operate a pharmacy benefit manager inside of Kroger, and we have about 600,000 lives on that platform. And so, again, another touch point for healthcare delivery. And then finally, where I have a lot of fun is around our food as medicine solution, helping our dietitians. And we're going to talk a lot about that today, but that's been really, really fun. And then helping with the benefit design and strategy on the Kroger side. We have over 550,000 associates around the country. So that's been a huge honor. And by way of a little bit of background, I'm a board certified preventive medicine, occupational medicine, public health guy. So been with Kroger about 10 years now.
That's awesome.
Thanks for having me.
Thanks for bringing them together, Brian. This is so insightful of you with this follow-up, because Best Buy Health is really also internalizing into their own communities everywhere that they have stations. And they realized many years ago when you first started this was, we have connection, we have technology, we know how to kind of fit it together, but we need partners to do it. So we're going to be exploring these innovative approaches today to improve patient access to food as medicine. And I love that expression. I believe in it. My sister, Teresa Uri, in Melbourne, Florida, is a registered dietitian, and she works with people in recovery with specific food plans for specific things, including allergies. And I think that lifestyle programs, enhancing our wellness, the longevity that brings us, the way it makes us feel, I think this is so key to the longevity of our country and strengthening our country. So I want to kick this over to you, Brian, just to open us up a little bit of what the concept of our conversation is going to be today.
Yeah, and I'm super excited to always be on your show, Todd. Thanks again for welcoming all of us. And I think the next generation of access to improving health is going back to the basics, food. And Kroger knows this well. And I think from a clinical and non-clinical perspective, the social world that we live in, and those challenges that are meeting the human condition, where they are and trying to improve them, Alex knows best. He's worked from a tech company to a health access service company in what Humana does and the different entities that they partner with and own. And I think going back to his early comments, it's around how we have creative risk-taking partnerships that are new. That's why they're creative, and there's a little bit of risk involved. You got to have new partnerships to drive really challenging initiatives forward. So I wanted to add on a little bit more of what Alex commented there. It takes a very vast and complicated village that communicates really well. And these brands here are on the continual effort to do that. So talking about next generation healthcare, it's really that access point of food, like a basic need, and the types of food that affect our cognition, our mobility, that ultimately affect our literacy of health and our interaction with health and our interaction with technologies that touch our health. So all these things are so interwoven together. I'm really excited to explore kind of what we're all working on together and what we're trying to do. And personally, I'm open to any additional partnership vendor conversations out there. If you have something to prove and you're doing something well and you're healthcare oriented, contact me. Easy to get a hold of, brian.urban@bestbuy.com. I'll help you as best I can, and hopefully we can help all the people we serve. So I just wanted to put that out there too.
We'll get you on TWIRx. That's what we'll do. We'll make TWIRx works. That's exactly what it does. Hey, so we're going to be talking about next gen access to food, medicine, and wellness. And I'm going to first kick this off to Dr. Ding. And I just, not to put you on the spot, but it's time. Like it's time to get in the kitchen and get into the good stuff. So our pharmacists listening, our pharmacy business people, the GPOs that we work with, the buying groups that we work with across the nation, what are the primary barriers patients are facing in accessing a nutritionist food and of course medication and preventative care programs too?
Yeah, I think the primary barriers are related to access and affordability at a very fundamental level. I think that response is kind of obvious, but I'm gonna go out a little bit on a limb and say that our healthcare system is part of that challenge. And I would say the way in which it is designed to work, or rather perhaps not work, is a major barrier to seeing food as medicine, to access to medications, and really incentivizing preventative care. I think one of the most pressing challenges we see as a country is the worsening burden of chronic disease. You talk about diabetes, hypertension, heart disease, all of which are rising. They account for the vast majority of healthcare spending in this country. And our traditional healthcare system hasn't really been built to prevent or manage these conditions effectively. It's largely a reactive healthcare system, and it's a fee-for-service payment model that often rewards volume over quality or value. And so things like preventative services, coaching, and support for things like food insecurity or medication adherence can really fall through the cracks. And so we think that the different approach is really Humana is trying to be an industry leader in advancing value-based care. So these are models that focus on prevention, management of chronic disease, and really looking more holistically at a person's health. And providers in these models are not rewarded for how many patients they see or how many procedures they perform, but really the health outcome in which they deliver. And that all having been said, access still remains a major barrier. So even with insurance, many patients struggle to access nutritious food, maintain consistent access to medications. And so we do things like screen our members for health-related social needs like food insecurity or loneliness, because we know that these issues are directly tied to poor health outcomes. And so I would say, in short, the real barriers aren't just about geography or infrastructure. I think they're about the cost. They're about the fragmentation of the entire system, and really a system that's not often designed to help people stay well. And I think we're really trying to work hard to flip that model, to invest more in prevention and primary care and addressing those kind of root causes of poor health so people can live longer, healthier, happier lives.
Thank you for that. And makes me think of, immediately as you're talking, I'm thinking, well, there's barriers in many communities throughout the country that are preventing our patients, our people, from getting access to health services, to food, to the rise of the pharmacy deserts, for goodness sakes. Dr. Watkins, how do those determinants, how do those barriers to health and to food, and how do they exacerbate these challenges?
Well, it just, Alex really summed it up and really called out probably the critical piece here. And I really want your listeners to just really gravitate towards this, that the number one determinant of health is access to care. It's not insurance. It's not economic or status or education. If you don't have access, it's an uphill climb. And so what we're trying to do, and where I'm so happy is that, and get so passionate about, is that when you really leverage the power of the pharmacist has intimate knowledge of what's happening, not only with your health, right? And having them really practicing the top of their license. It's just one of those aspects that we can leverage more effectively. Like Dr. Alex mentioned, right? We have a healthcare system today that is perfectly designed to give us the outcomes that we have. Just let that sink in for a minute, right? So we have we have internally, thousands and thousands of PharmDs here at wearing Kroger Blue every day, that I believe at times are not practicing the top of their license. They've been throttled down. It's like putting a governor on an engine and saying, hey, I'm going to allow you to only go so fast, right? So there's all this untapped opportunity. And so when we have these types of deserts, it's to further leverage the pharmacists so they can deliver care. So whether that's a test and treat strategy, whether that's a chronic disease management, whether that's, again, engaging in a food as medicine conversation, I think and there are some fundamental things that have to happen with legislation to advance particularly provider status for pharmacists. Things that we've been working on is around the legislation, common sense legislation with our government affairs folks around the equitable community access to pharmacists. ECAPS is one of those things that is common sense legislation that allows more access, right? So not creating additional barriers to care. There's way too much of that already. And let me just wrap this up by saying what we saw during the public health emergency, during COVID, and how the pharmacists stepped up. Many retail pharmacists, our competitors, independent pharmacists, were on the front lines, making sure that we got over this public health emergency. If it wasn't for them putting shots in arms, we could still be in dire straits with COVID, right? Now we've created an opportunity for the pharmacists to be part of healthcare operations at scale. We saw that how effective they were, and that's something that we can't roll back. So I get super passionate about talking about these things, Todd, as you can see.
That's awesome. What's interesting, I think what Dr. Marc just said, Todd and Alex, if you agree here, I think pharmacists, for me, thinking about the comments you made back to my Walgreens rare orphan disease analytic work that I had done from a data perspective, looking at all the touch points that pharmacists had at Walgreens at my time, across the counter, they're probably the most athletic and untapped health athlete on the team in the healthcare ecosystem, as you think of the broader view of it all. And I think not only are there challenges with licensure and coding of making them to a physician level, but what their capabilities can be beyond just that over-the-counter conversation and the dialogue they have, the intimate insights that they have. We're investing a lot of time, money, and resources in my day at Walgreens to tap into all these different SDOH data banks across the country, working with credit bureaus, which turned out flat for me, and then working with a lot of aggregators as well, which is quite unique. But the best insights we could have drawn were at the pharmacy itself, and we didn't do that then. And that program subsequently changed over time. But even back in my Cigna days, thinking about what Alex said, volume to value was a big part of Obama's second term, and the 50-90 rule that he was putting out to everybody is contracting your physicians more on performance-based and giving them access to data that could help improve outcomes and reduce total medical costs in certain populations. We're thinking as a financial institution when contracting with physicians. I think that's probably still there today, maybe Absolutely. In my Cigna brethren, but we didn't think about the partnerships that helped improve pop health. And I think now sitting in a tech spot, retail based, we think about the engagement and the experience that help backfill that and using technology to enable care, not deliver it, obviously. So it's like all these different evolutions that we're still going through. But I think we're really getting there thanks to the good brains that we have at a Kroger, at a Humana. So it just made me reflect on how valuable those insights are that we just missed. We were just so blind to it at the time.
That's an amazing point, and it's right on, because we're no longer. I'm in a generation. Before we started recording, we were making fun of my name, Todd, because it's a fad name from anyone born from 1968 to 1976. Our mothers thought Todd was cool, and the Barbie Todd was the boyfriend, and whatever. And that's a whole nother podcast is about the name Todd. But we were talking about, hey, we're in another age today. I mean, we're in tech. I went through a period of time where the most tech I had was the extended cord that I could walk away from the wall because there was a cord on my phone to get away from my mother listening to my phone calls. And the longer the cord, the greater tech that was to get to have privacy. And then now you jettison ahead, and there's generations that will never know kind of where we came from. And there's no excuse anymore because the internet is everywhere. Wi-Fi is everywhere. Access to the connectivity is definitely there. However, in some cases, and this is where, this is a bigger conversation, we're even seeing less access and limited access to connectivity in order to get answers, in order to stay connected to remote patient monitoring or something that is going to continue to make sure that health is forefront and it's out there and it's being talked about and we're not shying away from it. I want to shift some gears. We're going to be talking as food as medicine, and this is a transformative approach. And what that means is taking all of these pieces of everything that we've talked about together, and let's ask Dr. Watkins and Dr. Ding about population health and thinking about the bigger scale and what this really means for the role of remote patient monitoring, which pharmacists are starting to do, by the way. And I can't wait to actually get into that with you. But before that, we have to take a quick break from our sponsor, and we'll be right back with more TWIRx.
This episode is sponsored by Independent Pharmacy Cooperative, widely known as IPC. Established in 1983, IPC is the nation's largest group purchasing organization owned by independent pharmacy. With a mission of maximizing the success of community pharmacists, IPC works to provide members with access to effective programs and services designed to enhance profitability for independent pharmacy. Read more about our mission by checking out our website at ipcrx.com. That's ipcrx.com.
All right, food is medicine. I'm going to jump right into this. I'm going to start out, Dr. Watkins. The combination of a pharmacist, maybe some kind of advantage card that has the data of what you're buying, and now you know what medicine you're on, and maybe you're on something that you shouldn't have, grapefruit, and now the connection because you did scan your card and now you got a grapefruit, like maybe there's a alarm that goes off. I don't know, but it's so amazing that you have access to a ton of data in efforts to integrate the food, healthcare, medicine. Talk to us about that concept and what is, and then use your imagination for what could come to an innovation.
Well, yeah, and thank you for that, Todd. When consumers opt in, right, when they opt into our loyalty programs, we use that as a way to connect a little bit with them on an emotional and personal level, but it also allows us great insights, right? So we're able to collect this data and we safeguard it, right? It's very precious to us. And so as folks are opting in and we can see purchase behavior, we can see behavior at the pharmacy, but we also have the ability to ingest other types of data as well, right? So not only, third party or first party commercial data, where you're spending your hard-earned dollars, but we also have access, it's given that we have such a large employed population, to pharmacy claims data and also to healthcare claims data. And you kind of merge all of these together with the grocery data, where we're allowed to do this by law. We're able to kind of really develop a risk model profile. And when you're able to model risk in a population, and I think this is where you were getting to, and you're thinking about at a pop health level, what you begin to see when you sift out the data is that nutrition related diseases. Dr. Ding started by talking about chronic disease. Chronic disease is still the leading cause of death in this country. It's the number one expenditure that we see in our claims every year, right? And it's rising. There's one thing I've been sounding the alarm about for about almost 10 years now, maybe almost that long, is that we're at the rates where we're seeing a rising rates of cancer in the population. And we believe that there are 13 different cancer types that are driven by poor nutrition and obesity specifically. So as we've gotten fatter as a population, the risks of cancer have gone up in our populations, and we're seeing that in our claims as well. So when we're looking at food as medicine, we're looking at it as and we call it at Kroger, I get very passionate about it, as a dedicated, educated approach to eating and enjoying all types of food in order to prevent disease before it stops. I mean, before it starts, right? So that's, you are what you eat. So there's no ability that you're going to have to out-train a bad diet or to out-train poor nutrition. So to your point about pharmacists getting involved in nutrition, more claps for them. They need to be part of that conversation. And then where that intersection of data comes in, helping them make really good informed decisions to drive better health outcomes is really important.
I agree, Dr. Ding. You're kind of the king of the data right now because of the resources that you have through Humana's powerful networks and the data that you've collected over the years. So when we're focusing on that population health management through dietary interventions and medication management, like talk to us about those crossroads and from your perspective, from Humana's perspective.
Yeah, I think one of the things that Dr. Mark mentioned that certainly is very powerful about the data is really just being able to use that data to infer and to build these predictive models. But I think the thing I would go back to is just the idea of what I mentioned earlier, which is value-based care and how it really kind of unlocks or changes the incentives such that you're really looking at it more holistically in terms of the person that's in front of you, and you look more holistically in terms of the population and the panel of patients that our providers are managing, such that you're really able to go beyond the clinical setting to address some of the root causes of poor health. And I think one of the most powerful tools that we've mentioned is food, because as you all know, nutrition really does play a critical role in preventing and managing chronic conditions like diabetes and heart disease, which Dr. Mark mentioned, unfortunately, is increasing across this country. One of the things that we've done is we've partnered with the American College of Lifestyle Medicine to embed nutrition and lifestyle interventions into how care is delivered. And through this partnership, we've been equipping clinicians with the training, the resources, the evidence-based protocols to counsel patients on how food can be used as medicine. And that training is available to basically a broad set of clinicians, which includes our pharmacists, includes pharmacy techs as well, trying to make this as broadly available as possible. But I think, dietary change isn't just about the education either. It's also about access, as I mentioned. And to kind of help address this part, one of the things that we offer is a healthy options allowance on some of our select Medicare Advantage plans. And this benefit helps those eligible members pay for some groceries, pay for some of the over-the-counter items, and it really gives the members the flexibility to use it on that healthy food. And so I think by being able to combine the clinical education along with community-based resources with some practical financial support, we're trying to kind of bring together various different options to make it easier for people to access nutritious food and as a result build healthier lives. I think it's kind of how we're thinking about how you operationalize value-based care such that it really is more holistic in addressing the root causes of some of the chronic disease that we're seeing in this country.
I love it. And, the original idea that brought us all here today was our first conversation, Brian, where we were talking of examples of technology that were bridging the gaps of these rural, underserved areas that have these growing pockets of pharmacy deserts and healthcare availability and even food availability. What's going to make that up is the tech. So I'm thinking of you. I'm thinking of the team at Best Buy Health. How can healthcare providers, payers, tech companies, I always say together and then RX. So how do we work together, RX, to scale these solutions?
I think it's at an interesting point here where we have these unique benefit access designs that Alex was speaking about that you wouldn't have seen 10 years ago, that it's now affording you the opportunity to buy healthier foods. Before, it was more about guidance. It was care navigation. It was health engagement, real height of health coaches in the early to mid 2000s, like 2010, 2015. But now it's creating more clear-cut access to actually improve behavior change, which is the habits that continually make up our perspective on engaging with our health on a daily basis. And if you have a clear-cut path to making a better choice with food, building new habits that are micro, that go to macro of a new behavior, that's what a lot of, I think, intuitive health plan leaders are investing in today. This is something that Alex was speaking about. And then from a tech perspective, it's about creating access to a couple things. So our tech is great. It's everywhere. It's super engaging and it's fun. It has a rich body of data from a healthcare perspective of RPM and personal emergency response devices that I'm helping our chief data officer have a really clear unified data strategy. Like Marc was saying, we have all this data that's behavior. We can see what people are doing. The challenge is connecting the human component at the right time, at the right place for the right person, especially when we're looking at complex human conditions of I'm lonely, I'm having cognition decline, I'm living by myself, I'm elderly, I'm frail. Those are super complicated situations that you can't scale help. Like the PACE model, been around for 50, 60 years. It's a dying model. We can't scale that anymore. We don't have enough people. But when we start to blend tech, a unified data view, a profile of behavior, and then the actual service model, people going in the homes. I love Geek Squad Health Agent. I wish I had that shirt on today, Alex, but I just got the regular old Best Buy shirt on. That people component is a trust, a currency that's so valuable. It's almost impossible to get. But if you have a tenured Geek Squad Health Agent installing tech in a person's home, it could be scary for them to learn something new. But if we can share that data in a helpful way that shows a behavior and what we could get in front of, and using our payer partners, our health system partners from a care management, pop health perspective, improve their behaviors and then communicate trend and maybe even urgent episodes, then we're able to help the right place, the right time with the right stuff for the right reasons. And we're just starting to get there. And I think rural is on the map in a lot of ways. We have a great partnership with Geisinger, sits under Kaiser Permanente, Ryzen, the parent company here. And we're trying to figure out how do we start to make sense of our tech and our people. And it starts with literacy. And if we can help engage the literacy component of what they're seeing with their health and their tech to where they have access to food, the people part is still needed so we can finally connect the last dots to get them to improve their health from a behavior standpoint. That's a long way of saying we're getting there, but we have to start in some of the micro use cases, and then we can build from there. And I'm super focused on our fall detection prevention program and how that data unifies back to our caring team and how it's more thoughtfully shared to our payer partners and our health plan leaders as well, because that will make really great strategic decisions in what we invest into and then what we put aside. And we're just getting there. We're just getting there. And I think once we figure it out, we can move pretty fast.
The key word here, Dr. Ding, that I heard and I want to follow up is prevention. And prevention is all tied into reducing healthcare costs and minimizing hospital visits and managing those chronic disease states when they're not as serious and they haven't barreled out of control. So how do preventive programs reduce all of that of what I just said and minimizing those visits, and how does it make life better?
Yeah, I mean, I think that prevention is the foundation to how you deliver care in a value-based care model. And I think, many of the conditions that people have are manageable and progression can be slowed or halted and often prevented if we intervene early and consistently. And that's, what preventative programs are for. And so if you think about the public health framework at which they look in prevention, you've got primary prevention, which is preventing things from happening like vaccinations. You've got secondary prevention that detects disease early, like cancer screenings. And then there's tertiary prevention, which keeps diseases from progressing to complications. And in all of these cases, it's always less morbid and less costly to prevent or manage disease early rather than in late stages. And I think value-based care allows us to exactly design programs to do just that. And we've got various data that show in our value-based programs that people get more preventative care. And that results in things like better management of disease, such that they've got better blood sugar control, blood pressure control. As a result, they have fewer hospitalizations or unnecessary emergency department visits. And so it's much more than just about, using prevention as a way to reduce utilization. It's also about ultimately improving the quality of life. And, when we're able to keep people out of the hospital, when we're able to empower them to manage their health at home, I think we're really delivering on the true promise of what it means to keep people healthy as opposed to just taking care of patients when they get sick, which is kind of currently how the system is designed to work.
Reactive instead of proactive. And I think it all starts in our gut, to tell you the truth. And the follow-up question for Dr. Watkins is, I think of, there's got to be a report out there. I'm going to research for this study. I should have actually had this done. It should have been my TWIRx homework. But if I do some research, the advent of the TV dinner back in the day, okay, could we look at that timeline and quickly assess of when obesity in the United States has become so rampant, to see how it started with the quick, the quick meal and not slowing down and not eating the right nutrition, and all of a sudden your sodium levels are way up. And it's just like, then all of a sudden the food organization started mighty thinking of, how do we produce something fast and cheap and get it out there. And I almost feel like in ways we've lost our way. So when Kroger's in the communities, and I walk into one they're not up here. We have different shopping up in the Pittsburgh area. But when I went into Kroger's, because I have family down in Florida and the South, the produce section, the meat accessibility, the fresh stuff, I mean, it's the first thing that you get hit with. And that has changed since I was young. I was named Todd. I'm a Gen Xer. And back in the day, that wasn't as prevalent. It was like, hey, you just had your rows but it wasn't like, and are we shifting back from your perspective, Dr. Mark?
Well, retailers like Kroger have historically, and we've been in business for over 146 years. And so responding to food trends is something that we've always been resourceful at. And so one of the things you have seen is this move to fresh. You have seen a move towards a robust produce department, and many retailers, even some of our competitors, do that as well. So you think about walking into a grocery store, the first thing you're hit with on the left side usually is your produce section. You just can't miss it. We've also done a better job of sourcing locally historically. So you look at these trends, it was very difficult to have a variety of fresh in the stores year round. Now we have growing and farmers that are able to produce these types of produce and vegetables and fresh a lot easier than they were back in the day. And so that's right. There's also a strong correlation to the acceleration of our processed food that really accelerated coming out of the 1950s, particularly, and accelerated the rates of obesity as well. So there's a combination of changing in lifestyle. You move to essentially instead of a single income earner in a home, you went to two. You had people working outside of the home now, and so that you were relying on convenience a lot. And so again, manufacturers saw that they saw that they were working families and responded to that need, right? And so some of this was really high caloric, low nutritious foods that really accelerated the rates of obesity. And let me just maybe segue and share in places where it may not come to mind, where we have just incredible rates of diabetes and heart disease in countries that we hadn't seen before. So you saw the industrial acceleration in India and China, where you saw very low rates prior to their rapid industrialization. That now they have rates of obesity and rates of heart disease comparable to ours. And in the literature, we wouldn't see that. And when you look at what was it? Food. They left the farm to table. They were now in big cities. They were working longer hours, right? And so all of this contributed to the need to have convenient, affordable food, but at the peril of it being potentially high in calories, high in saturated fat, high in things like sodium, as you just mentioned. But that also, with this high caloric, low nutritional value food created this obesity epidemic, both in our country and then what we're seeing in other parts of the world as well.
I think Dr. Watkins has to be on the next Netflix special on gut biome, food access, because that's everything that pops up on my Netflix right now. And then, Brian Johnson, longevity medicine side of it that's connected into gut biome. And then Peter Attia's model over there. And then Gordon Chen, what he's trying to do with ThriveWell and Blue. And it's amazing because speaking from a sandwich generation perspective, much older parents, not doing well, young kids that require time as well. Convenience is still a huge need from those in their 30s to mid 40s, and I think those that are dual income earning houses really require easy convenience time. And I think all these food delivery models are great. Like we work with Instacart Health, we work with Uber Health from a transportation perspective. But there's only so much that our tech and our IT can push forward, that if we're still gapped on the sourcing of food, it doesn't matter. Like we're still just having garbage food, putting a more fast pace, just like the TV dinner comment and evolution that you both just walked through. I think that's where my challenge is we have this matrix of partnerships at Best Buy Health, but if we don't source the right stuff and our data isn't ticked and tied, and we're not seeing the clear profile, then none of it matters. So I think the sourcing of the food is so critical. And I think Dr. Watkins, that's my pitch for you on a Netflix special in the future.
So you have to get on it. This has been great. I've really enjoyed this conversation and being able to deliver this to our pharmacists and our pharmacy owner listeners to then ask the next question. I'm going to ask each of you. I want you to share your vision for achieving that healthier, more equitable environment in our country from your perspectives. I'm going to start out with Dr. Ding.
Sure. Well, my vision is really about fundamentally shifting the healthcare system from treating illness, just as you mentioned, from being reactive into one that is about promoting health and wellness and really being proactive. And so that, I think, is what we're trying to do by investing in value-based care models, where we're really trying to align the system around quality and outcomes, not just volumes. And I think these models really create the space and the resources for care teams to address not just the medical issues at hand, but also the social, the emotional, the lifestyle factors, as we talked about how important nutrition is. And that really means kind of broadening the importance of the entirety of the care team, whether you want to talk about behavioral health, dietitians, social workers, care coordinators, pharmacists, really into being part of that primary care team. And as we're doing that, we definitely are seeing real results in our data in chronic disease management. As I mentioned, fewer hospital visits, improved quality of life for our members. In fact, I'll make a shameless plug for where you can find some of that data that we share publicly. It's at humana.com/VBC. We publish a report on our value-based care findings each and every year, and some interesting aspects in value-based care as well that I'd encourage and welcome your listeners to check out.
That's going over a decade, right? For how many reports you've put out?
It is. That's right. Yeah.
Or at least 10 years. Something like
yeah,
that.
it is. It is.
Yeah.
That's humana.com/VBC, stands for value-based care. That's great. Dr. Watkins, same for you, though. I'm curious, and you're coming from a different perspective, but you merge with where Dr. Ding is as well, which is really interesting. How do we achieve? What's the vision? How do we achieve healthier, more equitable communities and embracing that?
Yeah, first, thank you for that question. I think it's very insightful. Right, so I think we have to move away from competition to collaboration, shared collaboration, understanding that it's value based, not volume based. It should be outcome focused, right, and it should be equitable and transparent, meaning that you're able to work with a very diverse team whether it can be a physician-led team, it could be a pharmacist-led team, it could be an advanced practice model team coupled with registered dietitians, but understanding that they're all working together around improving the health of the communities that they serve, right? And so it needs to be again local and interconnected, and those are some of the things that have to happen. Those must be true, right? So if they're not, we're back. Let me just back up, right? I think many of us already get it, right? The status quo has gotten us here. The status quo has gotten us worse in the industrialized nations and outcomes. We've lost years of productive life, right? We're not living as long, and we're not living as well the later we live in life, right? So we see all of these conditions that are driving disease in this country, and we're almost handcuffed. So unless we begin to change some of the things that we fundamentally do, we're not going to advance this. And so my vision is that we move away from things like competition to collaboration, as I said, right? We look towards things that are value-based instead of volume-based. Reward the value and align the incentives around creating a prevention model strategy that really keeps you healthy, right? Keeps you in the game, so to speak.
Thank you so much. I want to thank you. I want to thank Mark. Thank you so much, Alex, for making time and the scheduling. I know how busy you both are. Brian, you bring us the best people just to dig into population health issues, and just want to thank you for doing that and your commitment to this. This is important to us at Pharmacy Podcast Network to get people plugged in, get our pharmacists plugged into people like Mark and Alex that are really helping to level us up, get us to the next level. So want to thank you all for being part of TWIRx. Don't make this your last time. We had a lot of fun today. Where can people find you, Brian?
Yeah, you can easily find me. There's a few Brian Urbans on LinkedIn. I'm the less of the top tier weirdos out there that are named Brian Urban. Just the plug. There are a few out there, but I'm the only one at Best Buy. Brian.urban@bestbuy.com or LinkedIn messaging. I'm very accessible and happy to interconnect a lot of different players into the ecosystem. So like Dr. Watkins was saying, we have more of a collaboration effort and less of everyone trying to bite for a piece of the healthcare money pie. We can all start to actually fix things better if we're healthcare oriented, person oriented first. Everyone will be making their money. We'll all be good, but we got to work together to do it. So that's my spiel, but that's how you can find me. And Alex and Mark, I love you guys. Good voices and good people need to keep being lifted up. And it's a good platform that they're able to be on with you, Todd.
Absolutely. And as I said in the beginning, when we were in the green room, please use this platform to reach out to pharmacists in specific conditions, specific, issues. Dr. Mark, come back and talk to us about nutrition specific for children. And I'll put you in touch with Dr. Jenna Quinn, who leads our podcasts that are all about pediatrics, all about drilling down into our kids. And the same with you, Alex. I'd love to have you back. Let's dig down into, like I said, you guys are going to the specialty pharmacy conferences and different things are happening. Let's a shout out to Alita Postel, by the way, who's a brand new business development team member of Humana, and I'm going to meet her out in Vegas at the Assembia conference. So a shout out to you, Alita. That's my shameless plug of covering the event as press. Well, we enjoyed today's conversation. Thank you so much for listening to TWIRx. This was This Week in Pharmacy for April 11th, 2025. And like I said, we are in this together, TogetherRx. And we'll talk to you next Friday on TWIRx. Thanks for listening.
Thank you.